next part of the extraoral examination includes a cranial nerve examination. We perform this examination if there is a patient that has a significant facial pain component. The gross cranial nerve exam is done with actual ease. The most important part is to remember the 12 cranial nerves. So for olfaction, which is cranial nerve number 1, we'll just often ask the patient if they can smell a certain substance, perhaps the hand sanitizer, or if there is some type of solvent that has a very distinct odor. Cranial nerve number 2 is the optic nerve, and again, we often will perform this by asking the patient to read something on the history that they have brought into the patient. Part of the optic nerve is to also identify the fields of vision, of which case we would ask the patient to look straight, and for demonstration purposes, ask for them to evaluate when they're able to see my fingers in their peripheral vision. Tell me when you can see the fingers.
No.
Beautiful. And
no.
the cranial nerve number 3 is your oculomotor nerve, and that nerve often is tested by asking a patient to follow your finger as they hold their head steady. As you're asking them to look at your finger in all of its movements, you're also asking them, you're also checking not only the 3rd cranial nerve, but also the 4th cranial nerve and the 6th cranial nerve. The 4th cranial nerve being the trochlear nerve, and the 6th cranial nerve being the abducens nerve, which controls the lateral rectus muscle. The lateral rectus allows for lateral visualization, and the trochlear nerve allows for downward and inward movement of the eye. As part of the gross cranial nerve examination, often we will have either a pen light, or if one is not handy, we'll ask the patient to look at the light and be able to determine whether or not the pupils are reacting to that light. We'll often cover one, followed by covering the other, and making sure that the light is in fact causing the pupil to constrict. For cranial nerve number 5, which is most important to the dentist, we will perform this cranial nerve examination in a little bit more detail than some of the others. If we remember, cranial nerve number 5 is divided grossly into 3 segments. V1, which is the upper portion of the head, V2, which is the mid portion of the face, and V3, which is the lower portion of the face, all of which go to midline. Sorry about that. So we would like to test cranial nerve number 5 to light touch, to be able to discriminate between a sharp point and a dull point, as well as to be able to discriminate if something is cool, has a cool sensation. So for these purposes, I'm going to use just a standard gauze, and I'll ask the patient, as I place a little bit of the wisp of the gauze in different segments of their face. So I'll first ask them if they can feel this as light touch in all 3 segments. And can you feel that?
Yes.
And then I'll ask them, does it feel equal on both sides?
Yep.
In all 3 segments?
Yes.
Good. As part of this examination, I'll also perform a corneal reflex. I'll ask the patient to open up their eyes wide, and I'll just sort of brush very gently the cotton in the corneal region, and you'll see a normal twitch. In order to test sharp dull in a patient when we're in the dental office, we've devised a cotton applicator where we break the cotton applicator, and it is a sharp point on one end and a dull point on the other. Now we will ask the patient if they're able to discriminate sharp from dull. Once again, we'll do that in all 3 segments of the face, and we'll ask them if the sharpness on the one side feels equal or roughly equal to the sharpness on the other side. The last portion of the patient's examination will be able to discriminate if the patient can tell a cold sensation. And for this, our dental mirrors are very good tools where we can ask the patient, the metal, does that feel cool? And does it feel equally cool on the other side? Once again, we'll use that in 3 distinct areas. This is a very gross cranial nerve examination. However, if there are deficiencies in that nerve, further testing could be done. So thus far, we've accomplished cranial nerves 1 through 6. For cranial nerve number 7, this is our facial nerve, and this is the nerve that is associated when a patient has a Bell's palsy. This is a relatively easy nerve to test because we ask patients about facial expression. Would you please smile? And would you frown? Wiggle your eyebrows up and down? Can you blow up your cheeks? And also we'll ask them to close their eyes to see if we can part their eyes just slightly. Any facial weakness will be determined by this examination and would warrant additional evaluation. Cranial nerve number 8 is the vestibulocochlear nerve. This actually is a nerve that has 2 purposes. One is for hearing, the other is for balance. I will not perform a standard balance examination, but it'll be obvious in discussing with a patient if they're off balance, or upon the general survey in them walking in if in fact the patient has balance issues. A gross cranial nerve exam for hearing is to ask the patient if you can hear equally in both ears. Now, mindful, this is not a very detailed examination. For those purposes, a Rene or Weber examination is often performed to determine whether or not there is a sensorineural hearing loss or a conductive hearing loss. For today's purposes, however, we ask the patient if they can just hear us wisping our fingers together equally on both sides. Cranial nerve number 9 and cranial nerve number 10 are associated with, cranial nerve number 9 is associated with both motor and sensory perceptions. In fact, if the patient has some pain or even has a lesion in the back of their tongue, they'll often feel pain into the ear. And this is through cranial nerve number 9. Cranial nerve number 9 is also associated with the patient's gag reflex, as is cranial nerve number 10, which is referred to as the vagus nerve. So often when we inspect a patient, and I'll show you this when we look intraorally in just a minute at the patient's back of their throat, we like to see the tonsils and the back of the throat move up together evenly to make sure that there are no deficiencies in cranial nerves number 9 or cranial nerve number 10. Cranial nerve number 11 is the spinal accessory, and we'll ask the patient to shrug their shoulders, and we'll feel if there's good muscular tone in the patient's shrugging of the shoulders, which is, again, associated with the spinal accessory nerve. Lastly is cranial nerve number 12, which is referred to as the hypoglossal nerve. This is the nerve that produces motor to the tongue. So often we'll ask the patient to stick out their tongue, we'll ask to move their tongue right and left, and be able to follow commands in doing so. In patients that have a deficiency in the hypoglossal nerve, when they protrude their tongue may move to one side only. Can you pretend to do that for us?
Sure.
Right, which would suggest that one of the nerves on the right side or the left side is working properly, whereas the other side is not.